Okay. Well, thank you so much for joining us today, and thank you for choosing Western Health Advantage as your Medicare Advantage plan. I hope that these presentations we've had over the past couple weeks have been informative and helpful for you. We have recorded most, if not all of them, and they will be posted on our website for you to revisit at any time. And you can always call us at the Medicare team or member services if you have questions about any specific benefits. So with that being said, let's see here, get my computer to work. There we go. We're going to recap a little bit about who Western Health is, how to get started using your benefits, options for accessing your care, and we're going to review at a higher level the MyCare plan value added benefits that are included in both the MyCare and MyCare Plus. My name is Denise Gruden. I am the Medicare Sales Executive with Western Health Advantage. And again, I want to thank you for joining us today. So Western Health Advantage, who is Western Health Advantage? Well, we have been in and caring for our communities for well over 25 years. We're proud to say that we've built solid relationships with our providers and our partners. And this is a company that really stands behind the belief that patients do come before profits, regardless. In fact, 90% of all premiums received go back to the providers for your patient care. This is a nonprofit company, and our goal is to make sure that you are receiving the best care. So, your ID card, this is important. If you've received it, I want you to make sure that you take a look at the front of it and see that the medical group and provider are the ones you chose. On the back of the card, you're going to find helpful contact information such as member services, provider service number, and pharmacy information. So make sure you take the time and review your card. In the mail, along with your welcome packet, or actually separate from your welcome packet, you should have received by now your welcome brochure. This is a valuable booklet filled with tools and resources that give you information about your plan benefits, including the phone numbers and websites to many of the benefits, such as your dental, True Hearing, pharmacy phone numbers for both mail order and specialty pharmacy. So make sure that you look through that booklet. It's about, I think, 12 pages long, but it has a lot of tools and resources for you. If you haven't received it, please let us know and we'll make sure you get one. Okay, for those of you that have, terrific, but if you haven't yet had the opportunity to create your MyWA account, I want to let you know how important this is. This is wonderful. If you go ahead and create your MyWA account, this is basically your portal to go in, view your benefits on your specific plan, check for providers, look up medications to make sure that they're on the formulary, or even how to add them to your formulary if they're not. But you can do additional things like in addition to finding a provider, you can do a cost estimate on pending or upcoming procedures or surgeries that you might have. So make sure you check out the MyWA account website. And if you haven't created it, it's simple to just register and start using it today. So also, as a new Medicare member with Western Health Advantage, you may have received a new primary care doctor. If that is the case, I want to stress that you should set up your new patient meeting with that provider to get to know them so they can get to know you and to really start the beginning of a long-term relationship with your primary care. It's very important. If this is a doctor you've been seeing prior to joining the Medicare Advantage plan, you'll also want to contact the office and make sure that they have your most up-to-date member information as a Medicare Advantage member. If they don't get that into the system, they try to, bill your previous insurance, and then it just becomes a little headache if they don't have your current information. So make sure you schedule that appointment or call the provider's office. You have several options for seeing a doctor. Western Health Advantage Provider Network does have alternatives to in-person office visits. You can contact your provider's office or go ahead and visit the medical group's website, such as Dignity or the Woodland Clinic, and see if they offer telehealth visits as an option. This would be the same copay as if you were to visit the doctor in person, but you can utilize the virtual services from the privacy of your own home. If you have an urgent care situation that arises and you're in the Western Health service area, we always suggest that you try your primary care first. If they're not available and you need to seek urgent care services, you can either go to an urgent care or utilize the teledoc services for 24/7 urgent care virtual visits. Again, this is the same copay as if you were to visit the urgent care in person. You can learn more about the teledoc at mywa.org/mycareteledoc, or you can call the 800 number you see here on the screen. If you have a medical condition or concern, but you're not sure if you really are ready or need to seek the immediate care from your provider, you can always reach out to the WHA Nurse 24 advice line. There's no additional cost to use this service, and you can speak directly to a registered nurse in confidence, and they can help you decide what the best treatment or next steps would apply for your situation. They can tell you if you need to go to the emergency room or how to care for whatever ailment you called them with if a doctor's not needed as immediately. So all of us have struggled at one point in our life with stress, mental stress included. And our partner for behavioral health is Magellan Health, which offers flexible virtual care visits for the same copay as an office visit. If you're experiencing any kind of crisis, small, medium, or large, there's a 24-hour phone number that's provided to help you, and you can reach out in confidence again to someone who can help you through whatever you're going through. I am very proud to boast about the Advantage Referral Program. This is truly a unique program to Western Health Advantage members. This program provides you access to specialists throughout our entire network, even if they're outside of your medical group. If you have a specialist that you'd like to see and your provider agrees that care is needed, then all you need is a referral from your provider, and you can go see that specialist, even if they're in, let's just say you're in Sacramento and have Hill Physician as your provider network, and you want to see a specialist in the Providence network in Sonoma. Well, all you need is the referral from your primary care provider, and as long as that specialist is in our Advantage Referral Program, you're free to go see them. It's that simple. So there's no other Medicare Advantage carrier in California, at least Northern California, that provides a service such as this. So it's pretty awesome. It just opens up your options. So prior to coming to Western Health Advantage, if you've been receiving care from a non-participating clinical provider, you most likely can continue seeing that doctor if you meet the WHA transition of care requirements. To learn more about this, I'm going to direct you to call Member Services or visit us on the website and download the forms and information straight from our Western Health website. Prescription drug coverage. Both the MyCare plans include prescription drug coverage. And what's nice about Western Health is that there's a huge network of pharmacies. I know a lot of you, if you've come from other plans, similar Medicare Advantage plans, you've had restrictions on pharmacies. Some are preferred, some are not preferred. Well, I'm here to tell you that pretty much all of the major chains are preferred pharmacies with Western Health Advantage. So you can fill your prescriptions either at retail pharmacies or take advantage of cost savings by utilizing the mail order service on medications that you may take regularly. The specialty pharmacy provided is Credina Health, and they'll deliver your medication straight to your home or doctor's office, depending on who's administering that drug. So with the mail order services, the two providers that we offer the mail order through is Postal Script Prescriptions, also known as PPSRX, and Costco Mail Order. So this is important. Even if you're currently using Costco and you're new to Western Health and you're now going on to Medicare and using a Medicare Advantage, if you're using Costco Mail Order from your previous group, individual, or other coverage, you still want to call them to transfer your prescriptions using your new information. There's no membership required at Costco, and they're wonderful to work with. They can help you. You'd have to get your new prescription from your doctor and send it into Costco, and they'll get it all set up. Same with Postal Prescription Services. Again, if you're on specialty medications, Credina Health is the specialty pharmacy provider. Please call them at the phone number listed here, which is also listed on your MyWA portal, as well as your welcome booklet. And they have patient care coordinators. They will help you transfer those specialty prescriptions over to Credina Health. All right, so again, I'm going to talk about the choices you have with your medical groups and hospitals. So let's get into that. The 6 counties that Western Health Advantage offers Medicare Advantage plan are Sonoma, Napa, Yolo, Sacramento, Solano, and Marin. You can receive care from doctors and hospitals throughout the Western Health Network. Let's say a situation arises where you need specialty care from a provider or hospital that happens to not be in Western Health Network. Let's talk about that for a minute, because that's come up a couple times. If that's the case, unlike other carriers, Western Health Advantage gives all the power to care for the patients to the doctors and the medical groups. So you don't need to come through the insurance company to get approval or authorization for out-of-network care. That's done 100% with your provider and the medical group. The provider will give you a referral. It'll go to the medical group for approval, and it's that simple. So there's no in-between and no, for anybody who's ever tried to get an authorization from an insurance company, sometimes that can not go as well as we'd like it to. This way it kind of cuts out that middle piece and gives you access to the care you need quicker. Within that extensive network, we have 6 very large and powerful medical groups. Hill Physician, Mercy Medical, Meritage Medical Network in Marin County, North Bay Healthcare, which is in Solano County, the Providence Network, which is primarily in Santa Rosa, Sonoma, Napa, and Healdsburg, and the Woodland Clinic, which is in Woodland and Yolo County. Those 6 medical groups, providers work out of our very large network of hospitals, which include the Dignity Health Mercy Folsom, Mercy General Hospital, Mercy Methodist of Sacramento, and Mercy San Juan Medical Center, as well as the Woodland Clinic. Now for the Solano County is North Bay Medical Center, North Bay Vaca Valley Hospital, and in Sonoma County and Napa, we have Healdsburg District Hospital, Petaluma Valley Hospital, Providence Queen of the Valley Medical Center and Providence Santa Rosa, as well as Marin County, where we have Sonoma Valley Hospital and Marin Medical. Quite a bit of choice, wouldn't you say? So let's look a little bit at your benefits. These are the value-added benefits, not the core benefits we're talking about today. But if you have a question on any benefit, please put it in the chat box, give us a call, and we'll be happy to go over that with you. So for 2022, I'm so excited that we added dental, hearing, and a meal program for our members. This is in addition to the benefits that we introduced in 21. And we'll go into that in just one moment. So for the dental care, it's offered through Delta Dental. Now, Delta Dental is a DHMO, so it is a network of doctors. However, it offers comprehensive benefits with a large provider network. So you shouldn't have a problem receiving the care that you need through Delta Dental's Delta Care USA. Our hearing aid benefit was added this year, and this is provided through True Hearing. You can receive 2 hearing aids per year. There's 2 different. We've got $6.99 copay for the advanced model or $9.99 for the premium model. Now, these standard are non-rechargeable hearing aids, but you can pay an additional $50 and have a chargeable version of either hearing aid. The hearing aid costs may vary if you're on a group plan, so please check your evidence of coverage. And as I said, you're allowed 2 aids per year. For the non-chargeable hearing aids, we provide 80 batteries, up to 80 batteries, free of charge. Mom's meals. If you had the opportunity to join us for the meal presentation from Mom's Meals, boy, even I learned a lot. Not only are these meals tailored to your specific nutritional needs, they look so delicious. Mom's Meals has provided meals, you're going to have up to 56 meals post-discharge from either a hospital or rehabilitation center. So outside of that, I learned that you can order meals through Mom's Meals as a non-medical plan member. So whether you need the service because you just got out of the hospital and you have a specific diet you need to stick to, they can prepare these meals for you. Or if you just like the idea of not cooking and having healthy prepared meals, you can also go on their website and order on your own. So for 2021, we offered these benefits, which are continuing into 2022. It's our eyewear allowance, the over-the-counter benefit, which is for all non-prescription items you'd buy at a drugstore, 24/7 access to the Nurse 24 advice line, the telehealth service, our fitness program, which is terrific. It's not just a fitness program, it's a whole health program, in my opinion. And that's offered through Silver and Fit, our chiropractic and acupuncture visits, and Assist America, which again is a unique benefit to Western Health members. Exclusive, I should say. So let's take a look at those benefits individually. For the vision benefit, it's through MES Vision and includes a $100 or $200 benefit depending on the plan you're on. And this can be used towards your eyewear, things like your lenses or your eyeglass frames. This is a benefit you receive every 2 years. Now, your annual eye exam is done through the medical group. So you'll go through your medical group. You don't need a referral for your eye exam. That's good news. But just look for an optometrist or ophthalmologist within your medical group and set an appointment. Then if you get a prescription, that's when you can seek out any MES Vision provider. say Costco, Target, Stanton Eyewear, or right there in your optometrist's office. And you can use your credit towards your frames or lens every 2 years. Now, there is one exception. If within a 12-month period you have a change in your vision, like an astigmatism of 15% or greater, then, or 0.50, I think it is, then you can take your current frames that you already received with your credit, go to the optometrist and have your new prescription for your lens filled every 12 months. And then again at 24, you can change your frames again if you'd like. So it's a pretty nice benefit. Landmark Health Plan provides the chiropractic and acupuncture care. And this is alternative medicine that is terrific for all kinds of ailments. You know, if you have a sore neck or back, joint problems, headaches, arthritis, alternative care such as chiropractic or acupuncture can help alleviate that before you turn to traditional medicine. Members have up to 20 combined visits per year. It's 10 on the MyCare plan and 20 on the MyCare Plus. First Line Essentials is the over-the-counter benefit. And with the OTC, or over-the-counter benefit offered through First Line, members are provided an allowance of $50 per quarter on the MyCare plan or $100 per quarter on the MyCare Plus plan. Again, this is for non-prescription items like Band-Aids, toothpaste, vitamins, and so much more. You can order over the phone, online, and have the items delivered to you at no additional charge within 48 hours. And newly added, this is hot off the press, you can now order COVID tests through First Line using your benefit. Now, I understand that the government has allowed us 4 free test kits per household. Many people have been unable to obtain those, or they want more than 4. You can use, as an option, if you want to, you can use your benefits by calling First Line Essentials. I think one test kit box holds 2. So you have 2 tests for $25. So if you want 4, it's the whole $50. But just to let you know, you have that option. Now our next one, let's see here. We have Silver and Fit. This is wonderful. Silver and Fit is a very flexible program. You have access to locations to meet your unique needs or choose to participate in our virtual workouts. You also have a selection of home fitness kits that you're provided, and each member is allowed 2 kits per year. Again, this could be, you could choose items that are specific to your fitness needs. You also have access to numerous resources to stay active from anywhere, including 48 healthy aging classes. People love our Silver and Fit. Again, it's not just a fitness program. It's a healthy lifestyle program, I think. Okay, so now we're almost done, folks. Let's see, our health and wellness portal. Now, you can set individual goals through the MyWa Wellness program, and you can receive personalized action plans or create a personalized action plan, and you have the ability to track that progress. You have access to helpful health content, and you're part of a supportive online community. There's a lot of really great recipes on the MyWa Wellness website too, so I really encourage you to visit it today. So, Assist America, I love this program. You know, over and above worldwide travel, it's not a travel insurance, it's a benefit. It's an additional benefit to Western Health members, and it's exclusive to our members. So it gives you valuable resources when you travel 100 miles from home or more. You get assistance with refilling lost or forgotten prescriptions if you need map or directions, or need to find out where the nearest embassy is if you're traveling abroad, or help replacing passports. They can help you find and locate emergency care, even child care or lost luggage. If you're traveling with the grandkids and kids and you need some child care because you want to go out on the town, that also is available through the Assist America services. So that's the overview, the short and skinny of it, of our benefits program and your access to care. So what I'd like to do now is open it up to questions and see if you need me to go back over anything. Let's see, Eric, we have quite a few questions here, it looks like.
Yeah, so I've been addressing those as you've been going through the presentation. And yeah, you bet. But I do have one question, you bet. Has to do with first line benefits. Have they recently changed their name to Medline that you're aware of?
No.
Okay.
I am not aware of that. It is First Line Essentials.
Okay. We had a response that the person was told First Line is not available. It's now Medline Essentials.
Did you hear that? Whoever said that to you, did you hear that straight from the company?
We'll wait for her to respond. Another question we have here, Denise. You know, with any HMO, Medicare Advantage HMO plan like Western Health, if you have a true emergency, you know, you're able to go to the closest hospital emergency room. Of course, you'll have your applicable co-pays that are part of your plan. What if you wanted to go to a hospital, an emergency room that actually wasn't your closest? You just don't prefer that closest emergency room hospital.
So if you have a true emergency, you can go to any emergency room.
Okay, that's what I explained to them. They just had a preference that the one that is actually closest to them in our network is not a desirable, I guess, bad experience maybe before, and would choose to go to maybe a hospital in Roseville.
Hey, I understand this. Right.
Okay.
Right. If that's, you know, I understand this. I live right next to a hospital I don't think I would go to.
Okay. All right.
So I hear you.
Okay.
I go a little extra further, 15 miles away if I need to go to the emergency room.
Okay. Well, that probably helps.
Right. In an emergency, you can go to any emergency room.
Okay.
Okay. Is there any more?
No, I've been addressing all the other ones. I just want to raise those two because there were ones that I wanted to wait till you were finished with the presentation. But
I'm going to look up something. Yeah. I'll look up something here real quick on First Line. What was the name of the company?
Well, they were told that it was called Medline Essential.
No, it's First Line Essential, not Medline.
Okay, there you go.
Yeah. Okay.
Yep. So that looks to be it for all the questions.
Well, that's terrific. Again, we truly appreciate you choosing Western Health Advantage, and hope to earn your loyalty for many years to come. And if you have any questions for us, please feel free to reach out to member services at, is it 888-563-2250.
Hey, Denise, again, one quick, sorry to interrupt.
Sure, that's okay.
So for the person that asked the question regarding the First Line Essential, the actual 800 number, if you can grab a pen and paper and please write down this phone number for First Line Essentials. The number you should call to contact them is 866-582-1043. Again,
I'm going to go ahead and put that in the chat also. What is it?
582-1043.
I just put it in the chat for everyone.
Perfect. Thank you, Denise.
Yeah, of course. That's also in your welcome brochure. Is there any other phone numbers you might need?
Let's just wait here for a moment to see if we get any other responses in the chat.
Okay, so I went online and could not set up an account when I called the number on the flyer. Oh, is this for first line? See.
Different number. They're saying different
on
number on the flyer.
Is this for the first line flyer? The welcome book is not the one.
Yeah, okay.
Okay,
Yeah,
so
that
so the
number is to our Medicare
888-99.
department.
Yeah, that goes to the Medicare department. Okay, here, I'm gonna pull something up. Let me find this real quick. Okay, let's see. I'm gonna pull something up for everyone, and if you'd like me to send it to you, I'd be happy to. First line. In there. Of course, I can't find it right away. Okay, hold on. All right, so I have, Eric, where's the first line? There we go. Yeah, it sure does have the Medicare number. I have another book for you guys. You know what I'm going to do? Everyone that's on this webinar today, I'm going to go ahead and, let's see, I have everybody here. I'm going to go ahead and email you the welcome brochure and also separately the First Line Essentials catalog, which has the correct phone number and email in there. And we will go back and look at some of this material you've mentioned here and make sure that we have everything straight. So thank you for calling that out. If there's something incorrect, we'll fix it. Okay, is there any other questions we have?
Doesn't look like it.
Okay. Let's see, who can see your messages? All right. All right. Well, thank you so much. We appreciate your time, and we will be sending you an email with that information I just mentioned. All right, everyone. You have a wonderful day.